Hello and welcome. My name is Michelle. I'm going to take you through some basic first aid videos on behalf of Get Licensed. So my background is based primarily in leisure. I have been a first aider for about 20 years and I have been a lifeguard trainer assessor and first aid trainer and assessor for about 10 years. I've had lots of experience dealing with first aids, lots of different spinal injuries, bleeds, breaks, pretty much anything you can imagine I've come across, and I'm hoping that I'm going to be able to help you feel more confident about dealing with any of those types of things if you ever come across them. So throughout these basic first aid videos, I'm going to be taking you through the syllabus of an emergency first aid at work course, plus a few more advanced topics from first aid at work as well. So the sort of subjects we're going to be covering is your primary survey, CPR, choking, epilepsy, burns, amongst a few others as well. I hope you enjoy them. So, what is first aid? First aid is the initial assistance that is given to somebody that is injured or has become unwell until further medical assistance arrives. So if that is you, you need to make sure that first and foremost that you are not in any danger. You are the most important person, and make sure that there's no further danger to the casualty as well. There's some priorities of first aid that I'm going to talk you through. The first one is preserve life. So ultimately that is what we're trying to achieve. So we don't want anyone to die. So if we're going to get an AED and use that, do CPR, obviously that's all going to help preserve life as well as calling the ambulance. The second one is to alleviate any suffering. So anything we can do to do that, there may be just lying somebody down, sitting them down, just comforting them, maybe applying an ice pack or cold water if they've burned themselves, anything like that that can alleviate suffering. The next one is to prevent it from getting any worse. So that might be by applying direct pressure to an open wound. It might be, again, sitting them down or lying them down and raising their legs before they fall down if they're feeling faint or anything like that. And the last one is to promote recovery. So to promote recovery, that might be getting them a drink if they are low on blood sugar levels. It might be getting them to the hospital as quickly as possible. Okay, so there are your priorities of first aid. Preserve life, alleviate suffering, prevent the situation from getting any worse, and promote recovery. So let's have a little look at what you'll find in a first aid kit. There is a minimum recommendation of what to have in here. So you'll find a guidance leaflet, you'll find some plasters, you should have some gloves in there, which is very important for your hygiene. You should always wear gloves when doing any type of first aid, even if there's not any visual bodily fluid, you should have them on just in case. You've also got triangular bandages, which can be used for quite a few things actually, but slings is one of the main ones. You may have some ice packs, but usually that is an additional requirement that is added in after looking at a risk assessment. Also scissors might be an added requirement. And you have different shaped and sized bandages, so medium, large, small. You also have some eye bandages in case anyone has an eye injury. And you may have some adhesive tape as well to help apply any dressings. Okay, so this is some of what you'll find in your first aid kit. If you do find yourself having to do any type of first aid, like I've said, hygiene is really important. So wearing your gloves, but also washing your hands beforehand and also afterwards. Thinking about any cuts that you may have on your hands or up your arm, making sure that they are fully covered. Also, if you have a cold or anything like that, if you're coughing and sneezing a lot, perhaps try and get somebody else to do that first aid for that day, or just make sure you don't cough or sneeze over an open wound, and just keep yourself and the casualty safe. Okay, so I'm going to take you through your primary survey now, which is basically looking for anything life-threatening and dealing with that with your casualty. So throughout your primary survey, we're going to look at an acronym called Doctors ABC, which hopefully will help you remember this a little bit easier. So D is checking for danger. So first and foremost, any danger for yourself. You are the most important person, so we don't want you to get injured. Plus, if you get injured, then you obviously can't help the person that needed your help to begin with. So have a look around for anything that could injure you, just general objects that could get in your way whilst dealing with the casualty. Any gas, glass, fire wire, anything more serious, remove them, and only when it's safe to do so, approach your casualty. Okay, so we've removed any dangers. We now want to check for response. So you've got your doctor, we're on your R, so response. Is there any response from your casualty? Are they alert? Do they respond to any voice prompts if they're not alert? So hello, can you hear me? Can you open your eyes? Anything like that. If they don't respond to that, do they respond to a tap on the shoulders? If they don't respond to that, then we would deem them unresponsive. If you are on your own at this point, you're not going to want to deal with that on your own, so just shout for help. Okay, and then move on to checking the airway. Okay, so that's doctor's A. So airway, and what we mean by airway is opening the airway. So we're going to use a head tilt chin lift, which I'm going to show you on somebody in a moment. Okay, and by doing that could actually save a life already. Where the muscles will relax when somebody's laying on their back, the tongue will relax potentially on the back of their throat and could block the airway. So just by doing a head tilt chin lift, we could have already saved their life. Once we've done a head tilt chin lift, so we've opened the airway, we're then going to check for breathing. Okay, and we're going to do that for 10 seconds. We're going to be looking at the chest, rising and falling, and we're going to be listening and feeling for breath on our cheek as well. So we're going to get nice and close to the casualty. If we find that they are breathing normally, then we will have a look for any obvious signs of any injuries and deal with those, and then place them into what we call the recovery position, which is to maintain an open airway, which I'm now going to show you. So I'm going to show you practically now how to do your primary survey. Okay, so I've checked for danger. There's nothing around that looks like it's going to cause me or my casualty any harm. So now I'm going to check for response. I'm going to talk into both ears just in case there's any hearing impairment at all in one of the ears. Hello, can you hear me? Can you open your eyes? If that doesn't work, a little tap or shake on the shoulder. Okay. There's no response. So like I said earlier, if you're on your own at this point, shout for some help. Can I have some help? Now we're going to open the airway using a head tilt chin lift. So one hand on the forehead, two fingers underneath the chin, lift the chin and tilt the head back. So I've opened the airway. I'm now going to check for breathing. So I'm looking for the rise and fall of the chest, and I'm listening for breathing, and I'm feeling for the breath on my cheek as well. So he is breathing normally. Okay. So if I have any help at this point, I'm going to ask them to just stand by, and I will shortly be asking for a first aid kit and an ambulance as well if he hasn't come to. So I'm going to place him in the recovery position now. So I mentioned this earlier, and this is just a safe position to maintain an open airway. If I leave him on his back, the tongue might relax on the back of the throat, which could cause him to not be able to breathe. Also, he could be sick and he could choke on the vomit. Okay, so first of all, for your recovery position, what we're going to do is place the arm closest to us, up out of the way, and just wherever that falls naturally, don't try and force it down, just as though it's out the way. So I'm going to bring him towards me in a moment. I don't want him to squash his arm. I'm going to lean over and grab the far arm, and I'm going to link fingers with the casualty, and I'm going to place his hand against his cheek, and I'm going to continue to hold the hand there. You might have to shuffle down a little bit, because what you're going to do now is grab the outside of the leg that's furthest away from you, and you're going to lift that as high as you possibly can so the foot is as close to the bottom as possible. That is now your lever, so any size casualty should be able to turn any size casualty. Okay, so I'm going to push down quite firm to bring the casualty over and just take that foot off of his leg there. And then I'm going to slowly just take my hand away, and most importantly, I'm going to make sure the airway is open. Okay, so if he's like this, the airway is shut, so all I'm doing is just lifting the chin up slightly to make sure the airway is open. A couple of other things to think about before you turn your casualty is, do they have anything in their pockets? If they do, consider turning them to the side that they don't have anything in, or maybe take it out, but just be careful and place that by the casualty's head. Also, if your casualty is wearing glasses, you may want to take those off because they might be uncomfortable for them. But again, just make sure they're by the casualty's head, so if they do start to come to, we can quickly get them back on for them. Also, if you have a lady that's quite heavily pregnant, then lay them towards the left side. That is safer for the lady and the baby. Okay, so I'm now gonna ask my helper to go and call 999 because I have a adult casualty that is breathing normally but is unresponsive and has been for a good couple of minutes. So we've looked at our primary survey, assessing for anything life-threatening. I'm just going to talk a little bit about a secondary survey. So that's something that you might do for a conscious casualty, or it could be an unconscious casualty as well. So your secondary survey consists of looking at your history, signs and symptoms. So the history might be the history of the casualty, so perhaps any medical conditions that they've had that could link to why they're a casualty at the moment. It could be any medication that they're on, or literally the history leading up to what's just happened, so any physical activity or an accident of some kind that they've just had. Then we're going to look at the signs. So what can you visually see? Can you see that the casualty is perhaps sweaty? Do they look pale, flushed in appearance? Do they have any cuts or any obvious deformity or broken bones? And that can all help piece together what you're dealing with. You've then got symptoms, so that's something that the casualty can tell you, so it's really important that you listen to your casualty if they're able to speak to you. So they may tell you that they feel sick, that they feel hot, they feel cold. Any information they can give you can help determine how to treat them. For this video, I'm going to show you how to deal with an adult that is not breathing. Okay, so we're going to go back to our primary survey that we looked at earlier to start with. So check for danger, check for response. Hello, can you hear me? Can you open your eyes? There's no response. If you don't have any help at this point, then shout for some help. Open the airway, head tilt, chin lift, and check for breathing for 10 seconds. Look at the chest rise and fall in, and listening and feeling for breathing. What we're looking for here is for normal breathing. Okay, so anything other than normal breathing, we would start CPR. There's something called agonal gasps, which are kind of like the last breaths that may sound a little like this. Okay, that's not normal breathing. That's not what any of us are doing right now. So anything other than normal breathing, or you're not sure, start CPR. Okay. So my casualty is not breathing. I'm going to ask my helpers to go and get an ambulance and get a defib as quickly as they can, and I'm going to start CPR. So we're just going to try and buy some time for them by pumping on the chest and doing the breaths if you feel confident to do so. Okay. There might be a reason why you might not want to do the breaths if there's any blood or sick or anything like that, and that's fine. Just wait until there's a pocket mask, or just do continuous chest compressions. Okay. So I've checked for breathing, I've sent off for an ambulance and a defib. I'm now going to start CPR. So I'm going to place my hand right in the centre of the chest, right on the breastbone. So heel of my hand right in the centre. Okay. The other hand is going to come over, and I'm going to link fingers, and I'm just going to try and put pressure right on the breastbone, not on any of this part of the chest. A couple of pointers to make the compressions a little bit easier for yourself, but also the most effective for your casualty. Make sure that you place yourself as close to your casualty as possible. When you're placing your hand, make sure it is the heel of your hand right in the centre of the chest, a couple of centimetres above the bottom of the breastbone. Other hand's going to come over and link fingers. You're going to bring your shoulders in line with the rest of your arm. Okay, so you're above your casualty. Lock your elbows and then just come straight down on the chest. Make sure you fully release on the chest when you're doing your compressions, but don't come off the chest. We don't want to be bouncing. So I'm going to push down 5 to 6 centimetres. So that's 30 compressions, and that's at a rate of about 2 per second, so between 100 to 120 per minute. After those 30 compressions, without delay, we need to do some breaths. So head tilt, chin lift again, but this time we need to pinch the nose to get a good seal, because we're going to blow in the mouth. So put your mouth around theirs, do one breath, come away, take a breath yourself, and then do a second breath. As you can see, the chest is rising. If you're not sure if the chest has rose or if you think it was unsuccessful, just try those 2 attempts and make sure you've got a good seal and a head tilt chin lift is applied. Don't continue to keep putting those breaths in to make up for ones that are missed, because you could be there all day if there's a blockage or something else wrong. After those 2 breaths, straight back into your 30 compressions. And then your 2 breaths. And you're going to continue to do that at a rate of 30 compressions to 2 breaths until your AED comes or the ambulance come. The only reason you would stop CPR is if you were really exhausted and there was no one else that could take over, you would have to stop. If the casualty was to come to, which obviously we would hope would be the case, or if the paramedics tell you to stop when they do arrive. Okay, so remember, check for danger, check for response, make sure you've got some help, open the airway, check for breathing. If they're not breathing, ask for an ambulance and a defib to come back to you as quickly as possible, and start CPR by doing 30 compressions at a depth of 5 to 6 centimetres and a rate of 100 to 120 per minute, and then your 2 rescue breaths followed by your 30 compressions to 2 rescue breaths, and just continue that. Okay, so when you're doing CPR, there may be a couple of problems that might arise. So just so that you're prepared for them, I'll let you know. One of them is the possibility of breaking a rib. Okay, if you do break a rib, please try not to worry. It is at the bottom of our priorities. Breathing is first. Just make sure your hands are right in the centre of the chest and continue to do what you're doing at the correct depth. Don't change the depth of your compressions. Okay, another couple of things that might happen is the casualty might be sick. Don't worry about that, just turn your casualty away from you, allow them to be sick, drain away, come back, check for breathing, and then carry on CPR if they're still not breathing. Okay, so earlier I asked for an AED when I had a non-breathing casualty. An AED is an automated external defibrillator. It's a really clever piece of kit, and it can increase the casualty's chance of survival anywhere up to around 75% if it's got to them within the first couple of minutes. So what this piece of kit will actually do is analyse the casualty's heart rhythm and determine whether there's a shockable rhythm. It will try and shock the heart in order to stop the heart to bring it back to its normal beat, normal rhythm. Okay, so I'm just going to open this up and let you see what's in here. It's a really safe piece of kit, it can't harm you, so nothing to worry about. So what you're going to find is potentially a pocket mask, towel, razor and scissors, and the pads that we're going to apply onto the chest later, which I'll explain. So the scissors might be needed if we need to cut off any clothing. So the pads, I'll show you now, these ones, need to go directly onto bare skin. Okay, so we might need to cut clothing off. The razor is used if the chest is particularly hairy in the areas where we're going to place the pads. So we just need to have a quick shave of those areas to ensure the pads are going to stick properly. Pocket mask should be used anytime when you're doing mouth to mouth. So as soon as you have one, use them, and I'll open this up later on the casualty and show you. And the towel is going to be used if we need to dry the areas off, again where the pads need to go, just so we can get good contact to the skin. If we don't have good contact to the skin, then when it does shock, it won't transfer through the heart as we need it to, or it won't be as effective. Okay, so the defib that I'm showing you here is quite a lot smaller than the real defib, but it does act and explain things just as the real one would. Okay, so what I'm going to do now is I'm going to show you on a adult mannequin how to use the AED. Okay, so I'm going to show you how to use the AED now. So I've got my casualty that's not breathing, so I've done my primary survey, I've checked for danger, checked for response, I've opened the airway and checked for breathing, established that the casualty is not breathing normally, so I've asked for them to go and get an ambulance and bring an AED back for me as quickly as they can. Whilst they're off doing that, I'm going to buy the casualty some time by doing my 30 compressions to 2 breaths and continuing that cycle of 30 to 2. As soon as the AED comes back, I'm going to stop what I'm doing on the casualty and I'm going to open up the defib, okay, because this is going to give them the best chance of survival. So if there's anything to the chest that I need to prepare, so drying it off or taking off any clothes, so using the scissors or using the razor if the chest is particularly hairy, then I'm going to prep all of that. Make sure I turn the AED on and listen to the instructions.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
So on the pads it does have pictures, diagrams of exactly where they need to go.
Apply pads, plug in connector.
So just do that one at a time.
Apply pads, plug in connector. Analyzing heart rhythm. Do not touch the patient.
Everyone stand clear.
Shock advised. Charging. Stay clear of patient.
No one touch the patient.
Deliver shock now. Shock delivered. Begin CPR.
So as soon as the AED tells you to continue CPR, do so without delay. As you can hear, some of them have a metronome, so it instructs you when to beep, but you're still doing your 30 compressions to 2 rescue breaths. You'll continue to do that for around 2 minutes whilst the defib recharges and then analyses the heart rhythm again, and it lets you know whether it's going to shock or not. And then it will instruct you whether to continue CPR. The only reason you're going to stop is if the casualty shows definite signs of life, or the paramedics ask you to, or you're physically exhausted. Now obviously if you did have somebody else with you, you don't have to be trained to use an AED, although it does obviously give you a lot more confidence. But if you did have someone else, get them to do that whilst you continue to do compressions and breaths, and they can work around you with the defib. If you have a casualty that's not breathing, and obviously you need to do mouth to mouth, then using a pocket mask is the best thing to do mouth to mouth with. It just protects you if they are sick or if they have swallowed anything that's potentially poisonous that could get into your system. Okay, so you're going to open it up. There is a little attachment that comes with it that I'm going to show you in a moment, and you just need to push this bit out so that it looks like this. There is the word nose here, so it tells you exactly where you need to place it. So it needs to come over the mouth and nose. Make like a little diamond shape with your fingers and push down on the casualty's face. I'm then going to still apply a chin lift and tilt the head back. And then I should just be able to apply the same amount of pressure with regards to the breath when I'm doing the breaths. Okay. Now, if you do have an attachment like I showed you earlier, I don't always have them because they are only one use, then do use it because that just gives you another filter, so a little bit of added protection. So just pop that on and then just use it normally like I've just shown you. Okay. If you do have a smaller child or a baby and you want to use a pocket mask, then you may want to consider just turning it upside down because their face is a lot smaller and it does fit on a little bit better that way. But otherwise for an adult, just like that. If you find yourself in an emergency situation where you have a casualty that is not breathing, there's something called the chain of survival, which is absolutely key to giving somebody the best chance of survival in living. So the chain of survival consists of 4 links. So the first one is early recognition and call for help. Okay, so if you find someone that's not breathing, we need to establish that they are not breathing and it's not normal breathing, recognise that and call for help. So call for an ambulance and get an AED as quickly as possible. The second link is early CPR. So applying CPR, your 30 compressions to 2 rescue breaths as quickly as possible, and that will buy your casualty some time whilst the defib and the ambulance is on its way. The third link is early AED, so automated external defibrillator. So as soon as that is available, get that applied to the casualty and use it as directed to do so by the AED unit. The AED unit can increase chance of survival anywhere up to about 75% if it's got to them in the first minute or 2 of collapsing, and that will decrease by about 10% every minute it is delayed after that time. The fourth link in the chain of survival is early post resuscitation care. So basically making sure that they can get to hospital, get that medication and equipment, specialised medical equipment that they need as early as possible. So I'm going to show you how to deal with a child that is not breathing. Okay, so it's similar in the respect of the primary survey that we've done for the adult casualty earlier, but there are some differences in the process of CPR, mainly because the reason that they are potentially not breathing is more of a respiratory issue, whereas with an adult casualty it's more of a heart problem that we're dealing with. Okay, so you're going to check for danger. So again, first and foremost for yourself, but then also for your casualty, and remove any danger, or if you can't, then wait until someone can assist you. If there isn't any danger, then we're going to check for response. Hello, can you hear me? Can you open your eyes? Okay, there's no response. If you're on your own, then shout for some help. Open the airway, head tilt, chin lift, but just not as far back as you would on an adult casualty. And then get nice and close to the face and check for breathing for 10 seconds. So we're looking for the chest rising and falling, and we're listening and feeling for breath on our cheek. Okay, so the casualty is not breathing, so I'm going to ask somebody to go and get me an ambulance and a defib and come back as quickly as they can, and I'm going to start CPR. So like I said, because this is a respiratory issue, we're going to start off with giving them some much needed rescue breaths. So head tilt, chin lift, pinch the nose, get a nice seal, and we're going to put 5 rescue breaths in the mouth. We're just going to use one hand, again right in the centre of the chest, on the breastbone, and we're going to apply pressure 3 to 4 centimetres, around a third of the chest depth, and we're going to do that 30 times. Then we're going to do 2 rescue breaths. And then back to 30 compressions. So, 5 initial rescue breaths. If they don't come round after those 5 initial rescue breaths, we're going to very quickly go on to our 30 compressions, 2 rescue breaths, and then continue that cycle of 30 to 2 until the defib comes or the ambulance arrives. So I'm going to show you how to deal with a baby that is not breathing now, which is probably one of the most scariest things people can think of when we're dealing with a first aid situation. Hopefully I can put your mind at ease a little bit, and just remember, if no one else knows what they're doing, anything that you can do is better than nothing in this type of situation. Okay, so we're going to check for danger. There isn't any danger, so I'm going to check for response. Check for response on the baby. You can still try and talk to them, see if they can respond to noise. Maybe clap close to their face. Blow in their face, see if there's a reaction. Little squeeze, tickle on the feet or hands. Okay, so there's no response. So again, if you're on your own, make sure you've got some help. And I'm going to open the airway. When you're opening the airway for a baby, you need to be very careful and don't tilt the head all the way back, just in a neutral position. And I'm going to check for breathing for 10 seconds. Okay, so the baby isn't breathing normally, so I'm going to ask for an ambulance and a defib, and I'm going to start CPR. So again, with a baby, we suspect it's a respiratory issue, so we're going to start with 5 rescue breaths. And because the baby's features are so small, we're going to place our mouth over the mouth and the nose. When it comes to doing the 30 compressions, I'm going to use 2 fingers right in the centre of the chest, and we're going to put a third of the chest depth. After your 30 compressions, 2 rescue breaths. then back to your 30 compressions. Okay, so for a baby that's not breathing, check for danger, check for response, make sure you've got some help, open your airway, check for breathing for 10 seconds, and then start by giving 5 initial rescue breaths by placing your mouth over the mouth and the nose, and then do your 30 compressions with 2 fingers, and then 2 rescue breaths, back to 30 compressions and 2 rescue breaths, and keep doing that cycle until your defib arrives. Okay, so hopefully if a baby or a child has stopped breathing, you doing your initial 5 rescue breaths along with CPR will hopefully bring them round. But in the event that they don't, we have asked for a defib, so when it comes to us, we're going to apply the defib. But it is a little bit different than what we saw on the adult earlier. Okay, so you'd usually have paediatric pads with your defib, or you may have the ability to be able to change the amount of joules that is going to go through the casualties, the amount of energy. All right. For a paediatric pads, that is for under the age of 8, and obviously from 8 and above, we would use that for the adult pads. So you would do exactly the same as you did before, so turn the defib on and apply the pads as instructed to do so. But as you can see from here, we are going to place them in a slightly different area. So it tells us to put one on the back, and again, they can't have any clothes on, it needs to be bare skin. So one in the centre of the back, in between the shoulder blades. We're basically going to sandwich them in, so then one in the centre on the chest as well. Okay, and that'll be exactly the same on the baby, so one on the front and one on the back. But obviously with no clothes on. Okay. All right guys, I'm going to show you what to do if you suspect that somebody is choking. So we're going to look at an adult casualty to start with. So if you suspect someone is choking, perhaps you've seen them eat something and then start to panic. Maybe they're clutching at their throat. Maybe they're changing colour, maybe initially red to start with and then signs of cyanosis, so blueness of the lips. What we're going to do first, if we suspect they're choking, we're going to ask, are you choking? So, are you choking? He's nodded, he is choking. Okay, so the next thing we're going to do, if he is able to cough, we're just going to encourage coughing. So just keep coughing, that's it, keep coughing, well done, keep coughing. So as soon as the coughing becomes ineffective, we're going to have to take physical action. So we're going to get our casualty to lean forward and we're going to support them across the chest and hold onto the shoulder, and we're going to apply some back blows. So we're going to put our palm of our hand in the middle of their shoulder blades, and we're going to do one back blow, and we're going to come and check to see if they're managing to catch their breath or if an object has fallen out. If it hasn't, we're going to do a second back blow, check again, a third. If it's not successful, check again, still hasn't worked, fourth back blow, check again, and a fifth back blow, check again. Okay, if that hasn't worked, we're going to have to try something different. So we're going to try something called abdominal thrust. You may have heard it called the Heimlich manoeuvre. So we're going to place our hand, you're going to find the belly button and the bottom of the breastbone on the casualty and meet your way into the middle. Place a fist in that point and place your other hand over the top. And what we're going to do is push in and up in one action into the diaphragm, and hopefully that will release the object. 1, check. 2, check. 3, check. 4, does it come out? No. 5. Okay. If it still hasn't come out at that point, we class that as one cycle, so up to 5 back blows and 5 abdominal thrusts. So if after one cycle it hasn't come out, ask somebody to call an ambulance if they haven't already. And then we're going to continue that cycle. So we're going to do 1, check, 2, check, 3, 4, 5, checking after each one. If that's not successful, back to your abdominal thrusts. Again, up to 5, checking after each one. It's important that you do check. It may not be obvious it's come out straight away, they may be catching their breath and not be able to tell you. So the last thing they're going to want is more smacks on the back or abdominal thrust, because it can cause quite a bit of internal damage. So do make sure you're checking. Okay, so if the item does come out, then brilliant, but we're still going to get them to go to hospital to get checked out, just in case, as I say, they have done any internal damage, or if the ambulance is on its way already, then they can check them out when they get here. If it doesn't come out, it won't be long until they do collapse. So if they do collapse to the floor, we are going to start doing CPR. So we don't need to check for breathing. We know they're not breathing because they've been choking and they've collapsed for that reason. So we're just going to go straight into 30 compressions to 2 rescue breaths, checking the mouth before each rescue breath, just to see if there's any obvious signs of any food or whatever it is they may have choked on, which we can easily remove, and then continue with our rescue breaths. Okay, so I'm going to show you how to deal with a child that is choking. If you suspect a child is choking, that might be due to the fact that they have just been eating and now they looked quite panicked. It may be that they're changing colour in the face, maybe initially going quite red and then losing colour and maybe going a little bit blue in the lips. All right, so what we're going to do is we're going to ask, are they choking? And just establish that they are choking, so we don't unnecessarily do a procedure that could hurt them for no reason. Okay, so are you choking? Tells me, gives me the nod, he's choking. Okay, so what I'm going to do is I'm going to lean him as far forward as I can, let gravity help as much as I can, and obviously depending on the size of the child will allow you to do it a lot more if they're smaller. So lean them over and we're going to do back blows. So right in the middle of the shoulder blades, I'm going to use the heel of my hand. So 1, and check, 2, check to see if it's come out, 3, 4, check, 5. So I'm going to do that 5 times. Okay, it hasn't been successful, so I'm going to try something else now. I'm going to try abdominal thrusts. So I'm going to find the belly button and the bottom of the breastbone and meet in the middle, make a fist. I'm going to bring my other hand over the top and I'm going to come in and up into the diaphragm to hopefully release the object. So 1, check, 2, 3, check, 4, still not successful, 5, check. Okay, still not successful. So we class that as 1 cycle, so up to 5 back blows and up to 5 abdominal thrusts is 1 cycle. If it's not successful after that, send somebody to go and get an ambulance. And we're going to repeat that cycle again. So up to 5 back blows, checking after each one. And then back to your abdominal thrust if that is unsuccessful. Okay, and just keep repeating that process. You're probably not going to be able to repeat it too many more times before the child does actually collapse. So if they do collapse, what we're going to do is go straight into CPR. And unlike normal CPR, we're actually going to start with 30 compressions for the child, just because we know at this point that the breaths aren't going to get in, even though they do desperately need those breaths. So we're going to do 30 compressions. After your 30 compressions, we're going to have a look in the mouth, see if there's anything that we can release, and then open the airway and do 2 rescue breaths. If one or both of them don't go in, don't worry, go back to your 30 compressions and then try again next time. Hopefully now the muscles are all relaxed, the object might have moved on its own, or perhaps even by us doing the compressions, it has managed to move. So we're going to continue to do that until our ambulance arrives, and we need to make sure that we've also asked for a defib. So like any choking situation, it is time critical. If you've got a baby that you suspect is choking, what we need to do is get their head lower than the rest of their body as quickly as possible, and hopefully gravity will help. If that doesn't help on its own, we're going to have to do some back blows. Okay, so we're going to apply 5 back blows right in the centre, in between the shoulder blades. 1, I'm going to check. Make sure you support the head and neck. 2, 3, 4, 5. Okay, if that hasn't worked, we're going to turn the baby over and again get the head as low as possible, and we're going to do chest thrusts. So we're going to put our fingers one level below the nipple line, and we'll do 1 chest thrust, check the mouth, 2, check the mouth, 3, check again, 4, 5. If that's not been successful, that is 1 cycle. If someone hasn't already, make sure that they've called the ambulance and they've got a defib. And we're going to turn the baby back over again and apply the back blows. Again, up to 5, checking after each one. And then back to your chest thrusts, checking after each one. Okay, now hopefully that will work. If it doesn't, the baby stops breathing, so they'll probably go very floppy, so all the arms and legs will flop and they would have lost colour in their face and maybe have blue tinges in the lips. We're going to place them on a hard surface and we're going to start CPR. We're going to start with 30 compressions just because there's no point in doing the breaths at this stage because we know it's not going to go in because they've got a blockage. So 30 compressions. And just before I do the 2 rescue breaths, I'm going to have a little look in the mouth. If there's anything that's visible and easy to reach, I'm going to take that out and then do the 2 rescue breaths. If one or even both of them aren't successful, I don't attempt to do them again. I'm going to go straight back to my compressions. And hopefully, now that the body's starting to relax, all the muscles are relaxing, that object will move, or even by me doing the compressions, it will move and the breaths will eventually be successful. So we're going to keep doing that at a rate of 30 compressions to 2 breaths until our ambulance and defib comes, and we're told that the ambulance is going to take over. We look at 2 different types of seizures on the Emergency First Aid at Work course. The first is tonic-clonic seizure and the second is a focal seizure. So a tonic-clonic seizure is probably the first type of seizure that comes to mind that you've seen in movies. So it's when somebody falls to the floor and has involuntary muscle movements. So some quite erratic movements, and it can be quite scary to witness. You may also see somebody showing arching of the back and also maybe soiling themselves, eyes rolling back, maybe stopping breathing for a period of time, and also maybe some blood at the mouth as well, where perhaps they've bitten their tongue. So if you experience someone having a seizure, what you're going to do as a first aider is make sure there's no dangers around, especially to the casualty as well, with regards to anything that they could potentially whack their arm into or their legs into. And also we want to protect their head, so by placing something soft underneath it. Okay, so you've checked for danger, and then from that point, if they're still having their seizure, we're going to time the seizure. The reason we time the seizure, if it goes on for any longer than 5 minutes, that can be quite dangerous for the casualty, so we need to make sure there's an ambulance on its way. Okay, so we've timed the seizure. As soon as they've relaxed and all their muscles have relaxed and it's safe for us to do so, we're going to approach the casualty and we are going to continue our primary survey. So we've already checked for danger, we're going to check for response and then check for breathing. So epilepsy is just one reason why somebody may have a seizure. There are multiple others, and one of the other ones is a cardiac arrest. So that's why it's so important that we check for breathing as quickly as possible. If they are breathing, then we need to place them into recovery position to make sure we can maintain an open airway, and we need to make sure an ambulance is on its way. If it is longer than 5 minutes that they're in their seizure, if they don't come round and then have another seizure, or if we know it's their first seizure, or we're just not sure, we may not know this person and they've had a seizure, call an ambulance. The second type that I mentioned earlier is a focal seizure. So this is where somebody may just be almost staring into space, so an absent seizure. It may also include lip smacking, plucking at clothes, twitching, and just random movements, maybe wandering around. So this can also be very dangerous for a casualty, especially if they're in an environment maybe where there's traffic or anything like that. So we need to just try and get them sat down if possible in a safe space. Don't try and snap them out of it, just let them have their seizure. And again, time it. If it's longer than 5 minutes, call an ambulance. If you don't know that they've ever had a seizure before, call an ambulance. Okay, and just be really reassuring when they wake up and remind them where they are. Okay, so some more don'ts when it comes to seizures. Don't ever try and wake them out of it, so snap them out of it by trying to scare them or anything like that. When they're having a tonic-clonic seizure, so they're on the floor having their involuntary muscle movements, don't try and restrain them in any way because that could cause more damage. And also to yourself as well, someone's going to be especially strong when they're in that state. So just take a step back and allow the seizure to happen. Okay, so it appears that this gentleman is having a seizure. There's some erratic involuntary muscle movements. You may also see that they have soiled themselves, maybe that they're foaming at the mouth, or perhaps even that there's blood from where they've bitten their tongue. They may even stop breathing for a period of time, so it can be quite scary to witness. Make sure there's no danger. If there is anything potentially that could harm the casualty, move that out of the way so they don't knock their head or their arms or their legs or any part of their body. If you have a cardigan, a jumper, a pillow of any kind, just try and place it underneath their head to protect them from hitting the floor if they're on hard flooring. Just don't put your hands underneath because you could get broken fingers. They're going to be very strong. Make sure you just stay well back whilst they're having their seizure and time the seizure. If it's any longer than 5 minutes, then we need to call an ambulance. If we don't believe they've ever had a seizure before, then we need to call an ambulance, and if they injure themselves, we need to call an ambulance. As soon as they've stopped having their seizure, it is important to check for breathing as quickly as possible. So other causes of seizures may even be a cardiac arrest. So we need to open the airway and check for breathing. This gentleman is breathing, so I'm going to ask for an ambulance because I don't know if he's got epilepsy or what's happening with this casualty. So I'm going to call for an ambulance and place him in the recovery position. My name's Michelle, I'm a first aider. I'm just going to put you in a more comfortable position. So keep talking to them. The hearing is the last sentence to go and the first to come back, so even though they may not be able to respond to you, they may still be able to hear you. And just keep reassuring them and checking back on their breathing from this position. Okay, so in this emergency first aid at work course, we're going to look at 3 different types of burn. So we've got our superficial burn, our partial thickness and our full thickness burn. So if it's a superficial burn, you're going to see redness and just the top layer of the skin that's been affected. So it's going to be quite painful and quite sore to touch. What we're going to do for that superficial burn is run it under cool water, so cool running water for a minimum of 10 minutes. We may have to send this casualty to hospital, dependent on a couple of things. So if it is due to a chemical burn, then they would need to go to hospital, but also if it covers more than 5% of their body. So how do we know if it's more than 5% of their body? 1% would be the casualty's palm of their hand. So if it covers more than 5 palms of their hand, then they would need to go to hospital. For a partial thickness burn, you might see some blistering and some breaking of the skin. If you see that, again, run it under cool water for a minimum of 10 minutes and then look at applying some non-adhesive dressings, so something that's sterile. If you've got some clean film or something like that, then that's brilliant. Just tear off the first couple of sheets and then just apply that over the wound and just give it a little scrunch at the bottom. Don't do it too tight, don't wrap it around the wound. For a partial thickness burn, if it's more than 1% of the casualty's body, so just 1 palm of their hand, then they would need to go to hospital. Or if you're worried about any infection or you're not sure, just get them to go to hospital to get it checked out, make sure they're okay. For a full thickness burn, obviously this is going to be very serious. It might look quite charcoaled, there might be some waxy deposits, and also it may have severed the nerves, so they may not have any feeling of any type of pain. We may need to treat for shock in this case, and you may need to carry out some basic life support, so CPR if they was to stop breathing or go into shock. So for a full thickness burn, again, run it under cool water for a minimum of 10 minutes and even apply some dressing and call for an ambulance as quickly as possible. Okay, so in this example, we've got a superficial burn. So as you can see, there is redness. It's very sore for him and it's very painful to touch. So what we're going to do as quickly as possible is get him to some cool running water. It's important that it's just cool and not too cold. We don't want to cause hypothermia. If we can't get him to a tap, we can bring the water to him. Okay. I'm just going to pour the water on your hand now. What we need to do is do this for a minimum of 10 minutes. So if you've had to bring water to them, you'll need someone to keep supplying you with some more water. Make sure your casualty is feeling okay, and if they need to sit down, get them to sit down whilst you do this. Okay. After 10 minutes, we are going to have a look at the wound. If there is any blistering appearing or anything like that, then we may need to get them to go to hospital. If we are worried of any infection, we can cover it with a sterile dressing. Something like clean film is brilliant. Just tear off the first roll and then use the sheet after that so that it is sterile. And just place some clean film over the top and just scrunch it at the bottom. Don't do it airtight. But we can still then see the wound and we can still run the water over and see what's happening with that. If it is just a little superficial burn like this, then they shouldn't need to go to hospital. But as I say, if we are any worries about infection, then we would do. So having a look at some more minor injuries now. If somebody gets a foreign body stuck in their ear, in their nose, or if they were to swallow something that could potentially be harmful. So I'm going to tell you what to do there. So if someone gets something stuck in their ear or their nose, and it is really lodged in there, we shouldn't attempt to try and pull it out or get them to force it out by blowing from their nostrils. We should just leave it in there and advise them to go to their GP or to their A&E to get it removed, because we could do some quite bad damage to the ear and the nostrils. If someone has swallowed something that is potentially harmful, so maybe a toy or something like that, if it's a younger person, or there's been something in someone's food that they're not aware of and they've swallowed some plastic or something like that. Depending on what it is, will depend on whether they need to go to hospital. Something like plastic that's potentially got sharp edges, or a toy that's got sharp edges, or in a personal case of my own where I actually had some glass in my food. Obviously glass can do a lot of damage to your inside also, then we would definitely advise for them to go to hospital. Or just call the non-emergency number, so you can call 111 and get them to see if they'd advise you to go to hospital or not, or whether they advise just to allow it to naturally pass through the system. If you have to deal with someone that has a serious bleed, it's important that we stop the bleeding as quickly as possible. So what we would do is ask the casualty to apply direct pressure over the wound. So if you can just do that for me and apply direct pressure over the wound, push nice and firmly. What I would then do is ask the casualty to sit down in case they feel faint before they fall down. What I'm going to do is get my first aid kit, make sure I've got my gloves on and apply a bandage, and then look at treating for shock as well if the blood loss is quite severe. Okay, so I've got my casualty to the floor now. He is bleeding quite profusely. I just need to remind him to keep applying that direct pressure to try and slow the bleeding down. Somebody has got me a first aid kit, so I'm going to open up a large bandage. So if you can just take your hand off for me. Just let me know if this feels too tight, okay? So you want the bandage to be nice and firm, but you don't want it to cut off the circulation. So just check back with your casualty. Okay, so just make sure all of the bandage is completely covered, so we can make sure that there's enough pressure, blood's not going to continue to come out, and nothing can get in there to cause any kind of infection. Okay. How are you feeling? Okay, so if you just lie down for me, Okay. What I'm going to do is I'm going to treat the casualty for shock. So he's looking a bit pale. He is complaining of feeling of thirst. He is cold to the touch. He's got a rapid and weak heart rate. And he's feeling dizzy. So what I'm going to do is lay him down like he is and raise the legs. Can you just help raise your legs? That's great. Is that comfortable? Okay. So make sure you've called 999 as quickly as possible. Keep talking to your casualty and be ready to start basic life support. If the bleeding does come through this bandage, what we would do is apply a second bandage directly over this one. If it was to come through a second bandage, then we would remove them both and start the process again. We want to keep our casualty nice and warm. We can't unfortunately give him anything to eat, drink or smoke. Just need to keep him nice and calm and just keep an eye if he's deteriorating, if his response levels are dropping, and just, as I say, be ready to start CPR if required. So I'm going to talk about 3 different types of heart conditions. The first being angina, where the blood supply to the heart has been restricted. Now, most of the time someone would have been diagnosed with this, so they may have some medication that they can take. And quite a lot of the time it's brought on by physical activity. So usually once they've rested, you'll see quite a fast improvement, or once they've taken the medication, you should see them improve quite quickly. If you're in doubt and the medication isn't working, then just call 999. The second heart condition is a heart attack. So this is when the artery is completely blocked. So there is an area of the muscle of the heart is completely restricted from blood flow. So this can be life-threatening, and it's critical that we deal with that as quickly as possible. Some of the signs and symptoms that you might see for that is someone complaining of chest pain or tightness around the chest. They may say that their arm hurts, usually the left one first, but it could also be the right arm. They may also experience pain in the abdomen, the back and the jaw. They also may be experiencing nausea or actually being sick, feeling dizzy. They may be quite clammy and starting to look quite grey in colour. No 2 heart attacks are the same, and they can look quite different for each individual, and they may not experience all of those. So just be aware of all the different types of signs and symptoms, and if in doubt, just call an ambulance as quickly as possible. Okay, so we suspect that this gentleman is having a heart attack, so I need to ask for somebody to call an ambulance as quickly as possible and discreetly ask them to get an AED, so we have one close by just in case this person stops breathing. So ambulance on its way. I'm going to try and keep them as calm as possible. And I'm going to see if they have any chewable aspirin, so 150 to 300 milligrams of chewable aspirin, and that can help thin the blood and slow the process down. I'm going to place them in what we call the W position. So if you can just raise your knees, put them together, that's it. And I will just support you from the back. You can lean back a little bit. Okay, is that comfortable?
Yeah.
Yeah? So I'm just going to keep him nice and calm. If he has any tight clothing on around the neck or chest, I'm going to loosen that off. Keep him warm and just support him until the ambulance arrives. The third is a cardiac arrest. So this is different to a heart attack, and basically a cardiac arrest is when the heart stops working. So there is no blood flow around the body. So if that happens, you'll see them collapse to the floor, maybe going quite grey to start with before collapsing, and they will stop breathing. So then, of course, we need to call an ambulance, get an AED and start CPR as quickly as possible. Okay, so I'm going to take you through the signs, symptoms and treatment for a stroke now. Essentially, a stroke is an attack on the brain where the blood supply to the brain is cut off. So the quicker we act, the better, and the less damage is done for the casualty. So we're going to use the FAST test to detect stroke. So the FAST test is face. So does their face look drooped or fallen on one side? To test that, we can ask them if they can smile and see if both sides can lift up. A is arms, so ask them to raise their arms, and if only one of them can, then potentially they are having a stroke. The next one is S, so speech. So is their speech normal? Is it slurred? Are they saying things that don't really make sense? Or perhaps they can't speak at all? If you see any of those, then it's T, time to call 999 as quickly as possible. Okay, so I'm going to show you how to do 2 different types of slings now. The first I'm going to show you is a support sling. So what you might use a support sling for is an injury to the lower arm, so maybe a fracture, maybe an injury to the shoulder or collarbone, depending on what's most comfortable for the casualty, so they can direct you with that. Okay, so I'm just going to pop your arm like this. Open up your sling. Both slings are going to start the same way with regards to the direction of the bandage. So you've got a long part of the triangle, and then you've got the point which is going to go to the joint of the bad arm. Okay. Now for the support sling, I'm going to start underneath the arm, so the bandage is on the chest, and then we're going to use this point to come across the body. Then I'm going to tie it up around the back of the casualty's neck. Does that feel comfortable? Yeah. Then you can get a safety pin to use to support this section here, or just do a little twizzle and tuck it in like that. Now can you support? Can you just rest yourself? Does that feel okay? Yeah. Well supported, yeah? Yeah. Okay, great. So that is your support sling. Okay, the second sling is the elevation sling. So if we just put your arm up here. Okay, so this might be for a bleed, a sprain, or again, maybe an injury to the shoulder or collarbone. It depends on how comfortable the casualty is, and they usually will come to you in a position that is comfortable for them. So the sling, again, the long bit down the good arm and the point to the joint of the bad arm. Just place that directly over the top this time. I'm just going to tuck that bit under your little finger there and just support that there for me so it doesn't fall down. Then I'm going to get this point at the bottom and sweep it underneath the arm, and I'm going to come round the back of the casualty. It's going to tie up a little bit lower on the back this time rather than on the neck. And I'm just, again, going to do a little twizzle, or you can use the safety pin if you have one. They do come with most triangular bandages. Okay, can that support your arm now? Does that feel comfortable? Okay. Yeah. Okay, so that's it. That's your 2 slings. So if you suspect a sprain or a strain, the treatment for that is to rest the injury, to apply ice, to compress, and to elevate the injury. If you suspect a fracture, if it's a closed fracture, so the bone hasn't protruded through the skin, then all you would do is immobilise and support in the position found unless they're in any danger, keep them where they are and make them as comfortable as possible, and call 999. If it is an open fracture, obviously deal with any bleeding, but only apply as much pressure as you need to, and again, just immobilise and support and call 999. Thanks for watching. Hope you've enjoyed it and you've learnt some basic first aid skills. If you'd like to be qualified in first aid, please visit our website.